Hey guys, I am the Nurse Doc Tutor Asia. Welcome to my channel, and today's lesson will be on fluid balance. So we'll be talking about fluid overload, dehydration. We'll also be talking about the different types of IV fluids. And at the end, we will have practice NCLEX questions. So if you are struggling with understanding fluid balances and the different types of fluid, then this video is for you. So don't gatekeep it, share it with your friends so you all can pass nursing school. This channel is dedicated to helping you pass nursing school. So we're going to talk about hypovolemia, which is a fluid volume deficit, and that is the loss of fluid and electrolytes. And we're also going to talk about hypervolemia, which is a fluid volume excess, and you're going to have an abnormal retention of fluid and sodium. So first, let's talk about hypovolemia, and that is a fluid volume deficit. So how does this happen? So hypovolemia happens when there is a loss of body fluids or a prolonged decrease in intake. So this could be because of vomiting or diarrhea. So if that patient has that leads to a rapid fluid loss from the GI tract. If that patient has a fever, increased sweating, and insensible fluid loss. GI suction. If you have a patient who has an NG tube down, you are removing fluids and electrolytes from the stomach. Sweating, excessive sweating can lead to dehydration. Now, one that will kind of throw you for a curve is edema or ascites. So what happens with edema? So edema leads to decreased circulating volume because the fluid is trapped in your interstitial space instead of staying in your blood vessels, which is third spacing. So even though the body has fluid, it is not usable for perfusion, which can cause hypovolemia. If your patient is experiencing, if they have experience being in some type of fire and now they have massive burns, you can have fluid loss due to capillary damage and increased permeability. And then if your patient has a hemorrhage, and that is the direct loss of blood volume. So when we're talking about hypovolemia, we're going to think about fluid volume loss. So what are some ways that we can lose fluid volume? So what are some signs and symptoms of fluid volume deficit? So what is the patient going to look like? So the patient will have hypotension. So we want to think about this. Less fluid, you're going to have a lower blood pressure. Your patient can have tachycardia. So your heart beats faster, trying to compensate for the low volume. So when we think of hypotension and tachycardia, we think of what? Shock. So that patient will have shock signs and symptoms. Oliguria and concentrated urine. So the patient may not pee at all, and if they do pee, it's going to be very concentrated. So the kidneys are trying to hold on to the water to maintain blood pressure. Patient may also complain of dizziness. So because of the less blood going to the brain, that can lead to lightheadedness and dizziness. And the patient could have a thready pulse, which is a weak, rapid pulse due to low circulatory volume. So you want to know the signs and symptoms of patients if you are suspecting them to have a fluid volume deficit. So what do you monitor? So let's look at some lab values. So we want to look at the patient's sodium. So you may see that the patient could have an increased sodium due to hemoconcentration, or it may stay normal. Potassium. So you may see that the potassium will be decreased because your GI losses with your vomiting and diarrhea. Or you can see that your potassium could be high if it's related to kidney dysfunction. The BUN may be increased due to dehydration and reduced kidney perfusion. And then your creatinine, that may be normal or slightly elevated due to the kidney function. Your urine osmolality, that may be increased because your kidneys are trying to concentrate urine to retain water. And your specific urine gravity, that may be increased as well. Now another one, the last one I don't want to talk about is your hemoglobin and your hematocrit. That may be increased due to your hemoconcentration from your fluid loss. So those are different type of lab values that you want to monitor if your patient is in fluid volume deficit. So now let's shift our focus to what are we as the nurse going to do if we have a patient experiencing fluid volume deficit. So we want to make sure that we are monitoring the patient's I&Os because we want to be able to track the fluid loss, whether it be through urine, emesis, or diarrhea, and then you also want to track the patient's intake. So you will want to do strict eyes and O's on that patient. You want to make sure that you're monitoring the patient's vital sign. We want to watch for that low blood pressure and that fast heart rate, right? Because those are signs of shock. Also, we want to administer fluids as ordered, and we'll talk about fluids in the next slide to come. But you want to make sure that you are monitoring for skin integrity because dehydration can cause dry skin, poor skin turgor, and it can also lead to breakdown. So also you want to just think about it. So if you have a patient who is in fluid volume deficit, so let's say that your patient is hooked up to an NG tube suctioning, and now that patient is in fluid volume deficit and they now have a decreased potassium, we then want to treat the signs and symptoms of that potassium. So we want to make sure that we get that patient on a cardiac monitor. We then want to make sure that we are monitoring that patient's respiratory status. So you want, I know I only listed a few of the things of what to do, but basically we want to associate it with the electrolytes, and then we'll build our interventions off of that too. So like I said, if your patient has fluid volume deficit and they have then a decreased potassium, then our nursing interventions are going to focus on the potassium as well. So now let's talk about hypervolemia. So this is when we have an excessive amount of fluid. We're now in overload. So how does it happen? So a patient could have cardiac disorders such as heart failure. So you could have a weak heart and that fluid begins to back up in the lungs and in the extremities. You could have renal disorders such as chronic kidney disease, where your kidneys cannot excrete the excess fluids, leading to overload. They could also have liver disorders such as cirrhosis. So if a patient has a low albumin, that causes fluid to shift with ascites and edema. You could have endocrine issues such as SIADH, which you have an excess amount of ADH, which causes water retention and dilutional hyponatremia. And then pregnancy, so you have that increased blood volume and fluid retention, especially in the later stages of pregnancy. And then you also it could be caused by IV hydration. So let's say that our patient was in fluid volume deficit and we started them on fluids. Now we may have ran the fluids for too long, or we may have ran the fluids too fast, and now the patient now went from a deficit to now being in overload. So how is this patient going to look? So this patient is going to have edema. So this patient is going to have edema because of the excess fluid leaking into the tissue, causing swelling in the legs, hands, and face. So I don't want you guys to think like, oh wait, is we playing tricks on you or whatever. You can see edema and ascites in hypovolemia. Why? Because we said that patient is now third spacing, that fluid is not in the circulatory where it needs to be. But in this case right here with hypervolemia, this patient has too much fluid, but it doesn't say that it's third spacing fluid. So you would just pay attention to if it says that if the patient is third spacing, then we would know that would be hypovolemia. How about tachycardia is another thing you will see. The heart is pumping faster, trying to move the extra fluid. Hypertension, so you have an increased blood volume, which raises your blood pressure. You can have pulmonary congestion, so fluid then becomes the backup into the lungs, causing crackles and difficulty breathing. You guys, crackles is a big one. So when you go to listen to that patient's lungs, you're going to hear like a little Rice Krispie sound. That is like one of the telltale signs of fluid volume excess. All right, so a patient may also complain of shortness of breath due to that fluid volume overload in the lungs. And then also your patient could have jugular vein distension because the right heart overload causes the vein to bulge. So this is what your patient is going to look like. So some things that we're going to monitor the weight. So weight is the best indicator of fluid status. So rapid weight gain is going to be fluid retention. So weight gain is the best indicator for fluid status. Also, when you want to look at the BUN, that's going to be decreased due to the dilution from all the excess fluid. The hematocrit, that's going to be low because the hemodilution from too much plasma volume. Your urinalysis is going to show a low specific gravity, and that's because diluted urine if kidneys are functioning. And then chest x-ray, that's going to show pulmonary congestion, could also show a pleural effusion, fluid on the lungs. And then lung sounds, we're going to hear crackles, which is that Rice Krispie sound, and that just saying that that patient has some fluid on their lungs. All right, so that's some lab values that you want to pay attention to. So we know how the patient now is going to present and what are some reasonings for them getting hypovolemia. But now, what are you as the nurse going to do? So we want to make sure that we're monitoring our eyes and nose so we can track the patient's fluid intake and output to assess the balance. So 9 times out of 10, people who are in fluid volume excess, they normally are on strict eyes and nose, and sometimes they may even put them on a fluid restricted diet when the doctor may say that this patient can only have 2,000 mLs a day or whatever. So you'll just have to pay attention to the order. But knowing that they can restrict their fluids, monitor the vital signs because we want to be monitoring that high blood pressure, that tachycardia, and also respiratory signs of respiratory distress. You can be prepared to administer diuretics as ordered by the doctor. So we could be given a loop diuretic such as furosemide to remove the excess fluid. And then also we can put that patient on a sodium restriction, so limiting sodium to prevent further fluid retention. So we want to think about this because you guys have already watched the electrolyte video, but you want to know, we know that salt follows water. So if we have a bunch of salt, guess what? Salt is going to want to follow water. So you want to make sure that you limit the patient's sodium as well. So you may need to teach your patient about foods that are high in sodium and to avoid those. So now let's talk about the types of fluids. So first we're going to start with isotonic. So isotonic fluids, the little key phrase to remember is it stays where you put it. So these fluids stay in the blood vessels, and that is in your intravascular space, and they help expand blood volume. You will use this when a person needs more circulating volume, but not a fluid shift in cells. So example, this is going to be your 0.9 normal saline, this is going to be your lactated ringers, and this is going to be D5W. So D5W acts as an isotonic in the bag, but it becomes hypotonic in the body. So why would we use isotonic fluids? We would use them for if a patient is experiencing hypovolemia, which is low volume, right? Low blood volume. So if a patient from dehydration, a hemorrhage, or shock. So remember, hypovolemia, we're going to go with isotonic fluids because we want to increase that circulating volume, right? If your patient has a burn, you want to restore loss of fluids and electrolytes, and LR is preferred. But you will see like some facilities go-to fluids is normal saline, and some facilities go straight to LR. So they're both isotonic. Surgery/trauma, and that could be to maintain blood pressure and volume. So remember, isotonic, it stays where you put it. So it stays in the blood vessels, and it helps expand your blood volume, okay? The next one we're going to talk about is hypovolemia. tonic solutions. So the little key phrase for this one is go out of the vessels. So hypotonic fluids, these fluids move into the cells, causing them to swell. So think of that. Hypo, I think of hippo, you're big, okay? So you want to remember that they cause the cells to swell. So it's used when cells are dehydrated and need water to move inside. So think about it, hypotonic water, then it's going to come, the cell is dehydrated, but now we need to hydrate the cells. So we're going to use a hypotonic solution, and that caused the cells to swell. All right, so examples of that is going to be 0.45 normal saline, so half normal saline, and then you can have 0.33 normal saline, and then you're going to have D5W. So you remember, I said that D5W, that is an isotonic when it's in the bag, but once it hits the body, it's going to be hypotonic. All right, so please don't get that confused. So what is going to be used for? So you can use hypotonic solution if a patient has DKA. And DKA, you will learn about that in the weeks to come. But if you are not in my class and you're watching this, you could just go on over to my playlist of the endocrine and you'll see the whole DK diabetes lecture. But cells are dehydrated from high blood sugar. All right, then we can have hyponatremia, which means that we have a bunch of salt, right? High sodium levels. So this helps dilute the sodium levels. And then when you have cellular dehydration, we then can use hypotonic solution and causes the fluid to go inside the cells. So important thing that you want to know is do not give to patients with increased intracranial pressure or burns or shock, because this can lead to worsening when the fluid starts to shift and things like that. So that is so important. So remember, with hypotonic solution, the fluid is going to out the blood vessels and the fluids is going inside the cell, and it's going to cause the cell to swell. Cell to swell. That is going to be hypotonic. So the last one is hypertonic. So hypertonic fluids, they enter the vessel. So these fluids pull water from the cells into the bloodstream, making the cells shrink. Again, so hypertonic says that, guess what? These fluids pull water from the cells, so the water is going to be in the cell. It's then going to leave out the cell and try to go into your little circulatory, your bloodstream, right? But it's now going to cause your cell to shrink. So that's important to know. So examples of that is going to be your 3% sodium chloride. You can also have hypertonic solutions such as D5 normal saline, and then we can have D5LR, and then we could have D10W. So this is going to be used for patients who have severe hyponatremia, because it pulls sodium into the bloodstream, okay? So if a patient has low sodium levels, they can use a hypertonic solution. If your patient has cerebral edema, which is brain swelling, that reduces brain swelling by pulling fluid out of the brain cells, right? But you just want to make sure that you do that so carefully. Normally, hypertonic solutions are done in the ICU. All right, fluid volume overload with a low sodium. So let's say the patient had SIADH, because that corrects the water imbalance. So you want to make sure that you are monitoring this patient carefully. Like I said, this is normally done in the ICU because it can cause fluid volume overload and high blood pressure. So you have learned a lot. So now let's do some NCLEX questions. The NCLEX question says that a nurse is caring for a client receiving IV fluids for severe dehydration. Which assessment finding requires the nurse to slow the IV infusion? Is it A, a dry mucous membranes and tachycardia, B, crackles in the lungs and shortness of breath, C, low urine output and dark concentrated urine, or D, orthostatic hypotension and poor skin turgor? If you chose B, then you are correct. So if a patient is receiving IV fluids for dehydration, and now you can hear crackles in their lungs and they're experiencing shortness of breath, well, maybe those fluids are running too fast, and now we're pushing that patient into fluid volume overload. A client is receiving IV fluids for dehydration, begins exhibiting dyspnea, crackles, and a bounding pulse. What should the nurse do first? A, stop the fluids. B, lower the head of the bed. C, administer oxygen. Or D, notify the healthcare provider. So what are you going to do first? If you chose C, then you are correct. So you guys, one thing about these questions with priority. So first you would need to administer the oxygen because the patient is exhibiting shortness of breath. So while you throw that oxygen on, after you throw that oxygen on, you then can stop the fluids because we know that this patient is probably in fluid volume overload. But let's say that we stop the fluids first. No, we need to help the patient shortness of breath first, then stop the fluids. A client with heart failure is receiving IV fluids. The nurse should question which order. Is it A, 0.9 normal saline at 75 mL per hour? B, 3% sodium chloride at 100? C, dextrose 5% in water at 50 mL? Or 0.45 normal saline at 50 mL? If you chose B, then you are correct. So 3% sodium chloride is a hypertonic solution that draws water out of the cell into your extracellular space, increasing your intravascular volume. So administering this solution at 100 can lead to significant fluid volume shifts and volume expansion, posing a high risk for worsening heart failure and could even cause pulmonary edema. Therefore, this order should be questioned. So we want to make sure that we remember that this patient, we want to look at the clues in the question, and the question tells us that this patient has heart failure. So let's go through each answer option. Let's say, why could we use this one? So could we worry about the order for normal saline is an isotonic solution that expands your extracellular volume. While it can be used cautionally in heart failure patients, the rate and the volume must be carefully monitored. So it's saying like, okay, we should be careful with normal saline, but the rate of it isn't that fast. All right, and then also, let's see, the D5W. So D5W initially is isotonic, but remember, once it hits the body, it is hypotonic. So that leads to free water from being added to the body. So at the rate of 50, it provides minimum fluid and is less likely to cause fluid overload. However, continuous monitoring is still essential. And then the half normal saline, it says that normal saline is a hypotonic solution that causes shifts in the cells, and being that it was only going at 50 mL per hour, that is generally safe, but even though you should carefully monitor them. So the rule of thumb is that anytime a patient with heart failure is receiving IV fluids, you want to make sure they are being monitored. But we know that that patient cannot be receiving that hypertonic solution, because that hypertonic solution is going to draw water out the cell into the intravascular area. So I hope you guys got this one correct. I know I was kind of lengthy with the response a little bit. The question says, a nurse is preparing to give IV fluids to a client with burns. Which fluid is best? Is it A, D5W, B, 0.45 normal saline, C, lactated ringers, or D, 3% sodium chloride? So if you chose C, LR, then you are correct. So remember, lactated ringers, that is a isotonic solution. So remember, isotonic solutions, they stay wherever you place them, which is in your intravascular area. So that will restore their intravascular volume and correct any type of imbalances that you have. This is evaluating a client receiving diuretics for fluid volume overload. Which finding indicates treatment is effective? Is it A, increased blood pressure, B, a weight loss of 2 kgs in 24 hours, C, decreased urine output, D, increased jugular vein distension? So I'm going to give you some time to think about it. But if you chose B, a weight loss of 2 kgs in 24 hours, then you are correct. So we want to remember that weight is the best indicator for measuring fluid balance. And that's a wrap, you guys. I hope that this video was helpful in helping you learn fluid imbalances and the different types of fluids. So go ahead and like, comment, subscribe, and share it with all your friends. So I will see you guys in the next lesson.